And now for the first time today from our dynamic family interview area, we say good morning to Joni Smith.
Well, good morning, guys. You know what? We're already up to 4 calls. It's Friday morning. The sun isn't even close to up yet. You're listening to the Children's Miracle Network Radiothon. Gunderson Medical Foundation is on the phone banks. Oh, and there's a phone going already at the Versity Blood Center of Wisconsin phone bank. I was going to have them say good morning and cheer, but they're busy. Dr. Nicole is with us, Dr. Nicole Hennessy. Thank you for coming back again.
Good morning.
And actually, your commute down here this morning was pretty short.
It sure was. About 5 floors.
5 floors, that's
Yep.
right. Hospitalist
Correct.
here at Gunderson, taking care of the little ones.
Yes.
And what do you have right now for patients in the hospital?
So pretty full NICU, but on our pediatric floor, we've got about 4 patients right now.
And I have to just explain that when you think of long hours and you think of physicians, you may not realize it, but Dr. Nicole Hennessy started last night at 5 p.m. with her shift.
Correct.
Long days.
Long nights.
Has it been that way this week for you?
It's actually, we're in that kind of lull before the winter hits. So it's been busy enough, but not crazy.
We already have 5 calls. You appear
Yay!
to be the good luck charm this morning. And we have an anonymous donor that will match up to $300 this hour.
Awesome.
So, I mean, talk about getting things off to a rip-roaring start on a Friday morning. Can you tell us just a little bit? I would love to know more about another call coming in. Would love that. Love to know more about a pediatric hospitalist. What is it that you do?
So my job is to take care of kids while they're acutely ill and in the hospital. So if you need just a general checkup or you're worried that your kid is sick, you're going to go and see their primary doctor in the clinic. But if they're sick enough to come into the hospital, then I take over their care. So I take care of them just while they're in the hospital. I don't do any clinic time.
I would imagine, and I'm just guessing, that a lot of times moms and dads will be staying with the kiddos too.
Correct.
So you're taking care of the kiddos, but you're also helping to assist mom and dad through these really difficult times.
Yeah, my job is just as much taking care of the parents, which sometimes can be the harder patients.
Well, I would fear, anxiety.
Correct.
Not knowing what's next. And
Correct.
you've had a lot of, I think probably a lot of opportunities to learn a lot of the things that may be happening as far as when things progress. And you may know what's happening, and sometimes knowing that takes some of the fear out of it, and sometimes knowing puts the fear into it.
100%.
And so moms and dads obviously just trying to get through these difficult situations. And difficult situations, yesterday we have heard many of them with our families that have come in for Children's Miracle Network Radiothon, and how ways that that they have benefited and been helped out with the gas cards and with the meal vouchers. And after a while, it seems like it's just one of those things to predict. But when it's you and your family, and you forget to take care of you, and it sounds to me you run into that with the parents too.
Oh, of course.
Reminding them that they need to take care of themselves too.
And the other kids in the family, too.
What is your favorite part about being a peds hospitalist?
I get to have a really special role in people's lives. I get to be part of the scariest things, the things that people don't really ever want to deal with. And I get to help people make it through that. Make it through things they didn't know that they could handle themselves.
I would imagine that's probably sometimes just monumental. That's huge.
It is.
It's
There's
just huge.
sometimes a lot of tears.
Well, I'm sure it is.
Yeah.
What are some of the ways that you have seen in your department that Children's Miracle Network Hospitals has helped, maybe with equipment, or have you seen that?
Oh, of course. I was talking to a family earlier this week, and they said something that really stuck with me, and I think it's worth saying today. They said Gunderson physically gets people through their illness, but Children's Miracle Network emotionally gets people through their illness. That's how they survive. They keep food in their bellies. They allow them to be safe and comfortable during their treatments. It's anything from the meal vouchers to the...
There's another one. I mean, this is amazing.
The one that came up earlier this week is shirts when kids have ports in their chest to
Yes.
get their medicines. That instead of having to take their whole shirt off, they've got little zippers on these special shirts. Woo, more. So that they can maintain their dignity. It's little things that really allow people to emotionally survive in these difficult times.
And that's something I wouldn't even have thought of.
Correct.
And I know what ports are, and I know what they are in adults. And with kiddos, sometimes it's really difficult for them to understand why they have that in their body to begin with.
Yeah.
And then, every time you come to the doctor and, having to access that port, I would imagine that's traumatic to begin with. And having to undress the little kiddo, that's even worse.
Correct,
I would
especially
imagine.
in our cold winters and everything.
Every time we have a conversation, we find something new that Children's Miracle Network Hospitals jumps in and does. We have the isolette here.
Yeah.
And, when newborns and preemies are born, and that equipment, that does not come cheap.
No.
I just can imagine how much a piece of equipment like that, and there, of course, there's more than one here.
Correct.
There's lots of pieces. And, what we're doing here is we are asking people to maybe reduce their budget a little bit or increase their budget a little bit and call and give. And that's what we're doing. What would be a really super good reason that you would be able to express to someone why they should pick up the phone at 608-784-KIDS and give us a call today?
This is the time in people's lives that they never thought would happen. It's the scariest times in their lives. So this is helping someone in your family group, in your friend group, in your community, in your school, make it through. It's the little thing that you can do silently from behind to really support everybody that you know and love.
It may be silently, but it's not silently when you call in with your pledge,
No.
as we have heard already this morning, because we have quite a vocal group here, and the Gunderson Medical Foundation, they are just, listen to them, see? And some of these volunteers are not early risers, and they haven't been on the job for 14 hours either. But we appreciate them coming in so much because things are hot over there. And we have 5 calls already.
Yay!
They made the match. There we go. We have 5 calls in. We want more at 608-784-KIDS, 5437. Give you an opportunity to talk to our phone bank, Versity Blood Center of Wisconsin. And do you think when you have moms and dads that come in with their sick little ones, do you think they know about Children's Miracle Network before they come in? I mean, what have they heard of the organization?
It's some of them have, but
Yeah.
I would say a lot haven't. It's more our families that are with us quite frequently that really know about it and have heard about it. So I think it's often a little extra help that they're not really expecting when they get here.
And when they're not expecting it, and sometimes I don't think they know how it even happens.
Correct.
How they even get, on the radar.
Exactly.
And, maybe social workers, would you assume that's how
Our nurses are big advocates, our social
Okay.
workers. I'm being impressed more and more. The physicians are leading suggesting to families to fill out applications, and it's getting more of a name, and it's great to see it grow and thrive.
And one thing that we've heard from moms and dads, especially since they visit with us the last couple days, it's hard for them sometimes to say, okay, thank you for the help, I'll accept it.
Correct. Which I think is part of the reason that Children's Miracle Network tries to just do things from the baseline. It's not always that you need to ask for help. We're just going to be there.
And, sometimes pride gets in the way.
Yeah.
And sometimes you think, somebody else probably could use it more than we could. But when you're up for maybe even 48 hours in a row with your sick little one, you don't think about, did I eat breakfast? Did I have lunch? That kind of, I think your day just kind of morphs, doesn't it?
Yeah.
When you're in a hospital room and everything just changes. And when you have somebody come in and say, you know what? You need to go down and take care of yourself. We'll be okay. Go down and get something to eat. And you're right. It's the basics.
Yeah, we talk a lot about you can't take care of your kids once they're home and ready to be healthy again if you haven't taken care of yourself. If you end up sick or without the energy you need, then you're not going to be able to take care of them once they're back to healthy.
We've had this $300 match since you sat down and joined us this morning. Met that somebody else is doing another $300 match
Wow.
for the next 30 minutes. So our phone bank says, okay, give us a call because we've got another $300. We can raise it in the next 30 minutes. Now, we've got 5 calls going, and 5 calls right out of the gates. First thing on a Friday morning is huge.
It is.
Because what's happening at your house?
Everybody's waking up, getting ready, trying to eat, get out the door.
Well, and they are.
Yep.
And sometimes you think, geez, I don't even have time to call. Well, you know what? Maybe you do. At 608-784-KIDS 5437, because there's a lot of parents that have to make a lot of time for things that they may not think they need to take time for. Talking to one of the moms yesterday, and she said, you should see how long it takes us just to load up the kids and come in for doctor appointments.
Correct.
When you have siblings and you have someone that's in a wheelchair, you don't grab your purse and run out the door anymore.
No, and the number of medicines and how long that takes, feeding tubes and having to feed all night long. There's a lot of intricate, very time-consuming pieces to sick kids.
And we've had conversation, too, where feeding has to happen every couple hours. It's just how it is.
Exactly.
And moms and dads take shifts, you know, and getting the stretch of being able to get some shut-eye for 3-4 hours, to them, that's a long night.
Correct. Or even just get out the door and run to Target. You need to make sure you've got food with you just in case.
Exactly. So you're at home wondering, you know, should we call? What would you say to them?
Do it. Right now. Go.
And 5 calls we have. We're waiting. We're waiting for another challenge. We've got the other challenge, so we need you to step up to that challenge at 608-784-KIDS 5437. The Gunderson Medical Foundation on the phone banks this morning. The bright lights are on. We're at the main campus of Gunderson Health System. So when you first come in, you will see this amazing setup, and we'll be here all day today. So we're going to pull some hours. I hope you can get home pretty soon.
I am signing off here pretty quick.
You're signing off pretty quick. All right. What we're going to do is let you sign off.
Perfect.
Dr. Nicole Hennessy, thank you so much. You come every year. We appreciate it so much. And we want you to go home and try to get a little rest. Is it hard sometime after you've had a real challenging, and I'm sure just about every night here is challenging. Is it hard for you to get back into the swing of things when you get home?
It is. It's, they're all my kids. There's not one kid that I take care of that doesn't hit my heart. I've got little ones too. And so it's hard to not look at the sick kids and be thankful that my kids are so healthy, but also to not give that little extra prayer as I'm trying to rest for the day to everybody else who's still here.
That's the difference. That's the difference, because yesterday Dr. Sig was here, and he's emotionally involved as well, and I know you are.
Yeah.
I know you are. Thanks for spending your morning with us. Go home, get a little rest. You're listening to the Children's Miracle Network Radiothon, CMN Hospital's Radiothon. Put your money where the miracles are, a service of the La Crosse Media Group.